Hello, everyone. My name is Jackie Caglia, and I am a member of the 2022 U.S. Cohort of WomenLift Health. I am a public health practitioner specializing in maternal and reproductive health. I am a fearless female leader in global health, currently working as the director in the Office of Social Business Innovation at Merck on the team supporting our company's commitment to help end preventable maternal deaths. I am a wife and a proud stepmama, a daughter, a sister, and a friend. And I'm here today to talk with you about my leadership project around elevating the recognition of maternal health warning signs globally, called Hear Her. In order to do that, though, we will need to wind the clock back to 2019 when I first joined the team at Merck for Mothers. Fresh in my new role, trying to bring my public health expertise into the private sector for the first time, I received a challenge from my supervisor, mentor, and friend, Dr. Marianne Etiebet. We had been hearing countless stories over and over again about people across the US who had experienced a complication following childbirth. People who had known that something didn't feel right in their body, but for a host of different reasons, didn't receive the critical attention or care that they needed in a timely manner, or in some deeply unfortunate cases at all. Marianne tested me in my first months on the job to develop a consumer communications campaign that we could try to take to scale here in the United States. So I did my research. I looked at the challenge from several different angles, and I knew pretty quickly that this wasn't something we were going to be able to accomplish alone. So I negotiated more time to plan and planted several seeds with potential collaborators to see what might take root. Over a pivotal cup of coffee on the margins of a conference, the seedling of what would become the CDC's Hear Her campaign started to germinate. Through grants from Merck for Mothers to the CDC Foundation, we were able to join forces with the CDC's Division of Reproductive Health to develop a campaign to raise awareness about the urgent maternal warning signs during and after pregnancy. The campaign was designed for and with the people most impacted by maternal health complications in the US, launching first for Black populations in areas across the country with the highest maternal mortality ratios. And just last year, we added a most important segment to the campaign for American Indian and Alaskan Native populations. From the launch of the campaign back in August of 2020 through the end of last year, the Hear Her campaign has been translated into 20 languages. It's received almost 2 million page views, over 95 million impressions from digital and social media shares, and more than 1,000 earned media mentions. People have generously shared their personal experiences, including decorated Olympian Allison Felix, as well as folks like Mona, whose story was filmed in Taos Pueblo on the traditional homelands of the Red Willow people. Evaluating the campaign to date has shown that it's having an impact, both in raising the awareness and recognition of the urgent maternal warning signs, as well as that the campaign is helping to move people to seek more information, as well as talk with their healthcare providers. This truly has been one of the most collective, monumental, and moving moments of my career to date. But we are not finished. My vision is that everyone everywhere will know the warning signs of potential complications around pregnancy and childbirth. My hope is that the urgent maternal warning signs will become as widely recognizable as the signs of a stroke or someone choking. Ultimately, my goal is to shift social norms around listening to people who are pregnant or postpartum when they express concerns that something doesn't feel right in their body. In recent months, particularly through this leadership journey, we have begun exploratory work to see if it might be feasible to adapt this campaign for global use. Conversations are underway with subject matter experts around the world. And please consider my talk today an open invitation to join forces on this mission, as we will be looking for co-creators, co-funders, co-conspirators in order to bring this vision to life. I welcome your feedback and your questions, but before we open the floor, I have a large number of people to thank, as Hear Her really represents the contributions and creativity of many. In particular, I'd like to give a special thanks to my family, to my team, to my dear colleagues at the CDC and the CDC Foundation, everyone at WomenLift Health and the Center for Creative Leadership, and each and every one of my talented cohort mates, especially my journey buddy, the women in my mentoring pod, and our Tiger Kong coaching circle. Thank you so much.